When it comes to your health and your beauty, safety matters. Results matter. How far are you willing to go as a consumer to make sure that your treatments are safe and reliable? And as an aesthetic provider, how far are you willing to show your patient or client that your treatment, your services are meeting those safety standards? This is a hot topic, and I want to discuss it from both points of view. So let's get into today's episode.
You Are Beautiful, podcast with J. Kim, ND.
Welcome to the You Are Beautiful podcast with J. Kim, MD. I'm your host, Dr. J. Kim, a facial plastic surgeon, and I'm on a mission to make the world a more beautiful place, starting with you. There are 3 undeniable truths that you must embrace to become the most beautiful version of yourself. The first is that you are beautiful. The second is that you are unique. And the third is that you are worth it. Let's dive into today's episode. Let me start off today's episode with a story of a recent patient encounter. Any identifying information will be omitted for HIPAA purposes. The patient is a woman in her mid-40s. She came to the office requesting a Botox treatment. She requested that she see the Botox bottle before she received the treatment. So she signed consent. The aesthetic provider showed her the Botox bottle, and the treatment was performed. After a couple days, we received a phone call at the office from this patient saying that she would no longer seek to be treated at this office. When asked why, she said that the Botox was not reconstituted in front of her, and the Botox was not drawn up from the same bottle that was reconstituted so that she could see. When asked what her expectations would be of her Botox provider, she said that from beginning to end, she wants the Botox bottle where she could see it, so that from the freezer to her muscles, basically there is no moment at which she does not see the Botox bottle. Now, let's pause there and hear out what that means. In light of recent news in early 2024 about patients being admitted to the hospital after administration of counterfeit Botox in less than accredited places of business, let's say, there has been increased awareness about the authenticity, the quality, the safety, the reliability of aesthetic products. So when it comes to Botox, Botox is provided by a company called Allergan. It is purchased from there by aesthetic professionals such as this office. And the goal of having such safety measures is that we administer a consistent, reliable, safe product for aesthetic use. As much as this is about beauty, some could say it's about vanity. Ultimately, at the end of the day, this is a medical procedure. It is an administration of a drug by a licensed professional for your beauty. And that is the indication for this treatment, your beauty. So, in light of recent events, we've heard that a handful of people across the country were hospitalized after having received Botox treatment in different places of business. So that raises the question, does my aesthetic professional have Botox? Or is it an unlicensed black market product from an unreliable source? That is a legitimate question that every consumer should have in their mind. And as an aesthetic consumer, you deserve to know the answer to that question wherever you do get your aesthetic treatments. At this office, we carry Botox, we carry Dysport, we carry Xeomin, and these are all purchased from the vendor directly through our trusted sales reps. As a consumer, if you ask that question to your aesthetic professional and they do not give you a solid yes, you should be very concerned about the reliability, the safety, the source itself of where your medication came from. In particular, Botox is a treatment that will last several months. And so, if an unsafe or unreliable counterfeit or alternative is administered to you, as a consumer, you would deserve to know that. And as a professional, shame on you. The standard of care is to inform the patient of what you are administering and if they have any questions, to answer them. So the patient should be informed, hey, this is X medication, this is for this concern or this indication, and it's going to have this kind of result. There is a risk of X, Y, Z side effects. These details should be written out in a consent form and communicated to the patient on a regular basis. This is the best way to build rapport, trust between the healthcare provider and the patient. In the aesthetic setting, at least in this office, what we have is a set of consent forms for every procedure that we do, listing in a very comprehensive manner all the risks, benefits, and alternatives to this medication or to this procedure. We ask the patient to read over it thoroughly and ask any questions they may have even after reading this rather comprehensive consent. At the end, you sign, and if there are no further questions, you proceed with the treatment. The slippery slope of this is that no written consent will have or list all the possible side effects. There are certain very rare unforeseen side effects that could happen. There are very common ones that are usually listed in every consent form, and it behooves the provider to explain that no matter what adverse event or side effect or unexpected issue occurs, that we will be there to help them get through the issue and to address any concerns. So when it comes to Botox injections, this is for your beauty, and many people choose to have Botox regularly. It is a very common aesthetic procedure, and we know that there can be sometimes unwanted adverse events. Ideally, as healthcare professionals, we want to have 100% reliable, safe results, 0% adverse effects or bad events. But unfortunately, side effects will happen. That's just human nature. It's just the nature of the profession and of medicine as a whole. So when you think about what it means when this adverse event happens to you, the consumer, it does not mean that the healthcare professional did anything wrong. It does not mean that you, the patient, did anything wrong. It means that if you do so many procedures, yeah, you're going to have a couple events here and there that are not perfect to the T. And as aesthetic professionals and as healthcare professionals in general, we strive to achieve the best result for every patient every time. However, we are human, and so what that means is occasionally a not perfect event might occur. The ways to minimize that are to be appropriately educated in patient anatomy, physiology, to make sure that we conduct a thorough evaluation of the patient and we administer the service or treatment in the safest, most reliable way that we know. If there are adverse events, such as, for example, after Botox, you have a drooping eyebrow. And if you're watching on YouTube, you can kind of see that I'm making my eyes smaller for dramatic effect, although I'm not all that dramatic visually. But you get the idea that that can happen if the Botox treatment is not perfectly performed and the results are not perfect. That can happen. The key is, from the consumer's point of view, from the patient's point of view, to alert your professional of this issue and for the professional to acknowledge this issue, this concern, and help build that relationship, even though this was not an ideal event. So, as a consumer, there is no shortage of resources on the internet, on social media about aesthetic treatments, the goals, risks, benefits, alternatives. Any aesthetic professional's website will have a plethora of information that will help you with anything you need to know about your treatment before you have it done, and even during the process of achieving those results. The question is, at what point do we say enough is enough, that there needs to be a certain boundary in terms of what the patient needs to see, needs to know? Is there a point at which, I don't like to use the word neurotic, but is there a certain point at which the situation becomes neurotic such that it's paralyzing to the patient and to the professional? I can think of at least two other situations where we trust the professional to do a good job and we don't have the ability to see everything that they're doing. So if you've seen me as a patient, you know that two of my favorite analogy categories are food and cars. So in terms of food, when you go to a restaurant, do you see everything that the chef is doing? Like everything? Do you know where each ingredient is sourced? Do you know what pots and pans they're using? Do you know if they've washed their hands? I mean, 99% of kitchens are not open. So you're going to have to trust that the professional who makes your food makes it so that it tastes good and that it's not unhealthy for you. I mean, that's a whole other can of worms in terms of unhealthy food and processed food and fast food chains and stuff like that. But regardless, as a paying restaurant consumer, you are paying with the implicit belief that the chefs knows what they're doing, that the ingredients are safe to eat, that it's going to taste good, that you're going to get reliable results. If those results aren't delivered to you, then you're going to go elsewhere with your money to eat elsewhere, right? So at the end of the day, are you going to trespass into the kitchen and ask what ingredients are being put into your food? Are you going to ask where they come from, how they were sourced? No, you're not going to do that. So I don't know where that line is. And when it comes to aesthetics, I do know that when it comes to fillers or other one-time use treatments, some people like to see that the package is opened in front of them so that they know that it was not used elsewhere. There are some practices in terms of Botox where it's already mixed and already placed into pre-filled syringes so that all the patient sees is the syringe with the reconstituted Botox. It's not common practice to show the patient the bottle of Botox, so make of that what you will. As a patient, would you want to see the bottle of Botox in front of you before you have the treatment administered to you? I don't know what the right answer is. The other scenario where I make a lot of analogies is related to your car. Now, let's say your car has an issue and you take it to the shop. And they determine that X, Y, and Z repair needs to be performed on your car so that it will run safely and reliably for you for a long time. So you leave the car at the shop and they perform the services that they say they're going to, and then you pay the bill. Now, are you going to sit at the shop, ask to go where they're working on your car and watch every little detail? No, you got better things to do with your life, right? So at the end of the day, you're trusting this professional to do the right service for your car so that your car runs well and you're not getting ripped off. So again, where is this line when it comes to aesthetic services? Let's say that you're getting a professional skincare treatment. Your skincare professional is going to apply certain products to your face, and they're used for different purposes. They will be used in a certain sequence for a certain result that you will achieve for your skin. And these are all good. I think as a consumer, as a patient, it is good to ask questions about the details of the service that is being provided to you. The more informed the patient, usually the better the outcome. However, what is the point at which, or is there a point at which there's too much asking questions and getting too caught up in the details? I don't know if I have the perfect answer for that. There is a certain amount of trust that is implied between you, the patient, and the aesthetic professional. If knowing more about the ingredients, knowing more about the treatment helps to establish that trust, I believe there is room for both parties to come together and establish that trust, that rapport. I think there is an appropriate amount for the aesthetic professional to disclose to the patient in terms of, hey, this is this treatment. It's good for this indication. It's going to help you in a certain time frame. There's going to be maybe a little bit of recovery time or downtime, whatever that may be. And these are the results that you can expect. These are the number of treatments that you can expect. There are any number of details that will help the patient make the right decision for their situation. So when it comes to you, the patient, how much do you need to know? How much do you want to know? Some patients want to know very little. And sometimes you'll see patients saying, hey, I want this. I trust you. Just do it. And we'll have the patient sign consent. If there are no further questions, we will proceed with the procedure. At what point is trying to figure out too much going to paralyze you? So I think that there's a happy medium. And it all stems back to establishing trust between the patient and the aesthetic professional. If there is, on the patient side, an inability to wrap your mind around the fact that this aesthetic professional has your best interest in mind, and they're going to use the safest, most reliable way to help you achieve your results, then that's not a relationship worth building. I think in terms of the aesthetic professional's perspective, yes, there is a responsibility for us to educate our patients as well as possible. I think, though, that there is a line, and this line is different for everyone, at which we say, that's the information that I believe you need as a patient, and we're going to proceed with the treatment if you are consenting to it. When it comes to us aesthetic professionals being consumers, we have to buy the products and the goods that are going to help our patients achieve the most beautiful version of themselves. If you think about it, though, we have to ask the questions so that we know that these products are reliable, that they're safe, that they're going to give you the results that we want for you, that you want for yourself. And I think that if the patient has that thought in mind, that we as aesthetic professionals are going to go above and beyond to vet and filter out so that we get the reliable product, we get the safest, the best ways to help our patient achieve a more beautiful version of themselves, I think the patients should have some confidence in that, in terms of, hey, this professional is looking out for me. This person's not out to get me, not to scam me, but they're going to have my result, my safety in mind, so that I achieve a more beautiful version of myself. Again, this line is not a fast and hard line across the board with all aesthetic procedures. There are going to be some gray areas. And as a patient, you might feel that the gray area is here or that it's all the way over here in terms of, hey, I need to know more about this than the average person, or I'm okay knowing less than the average person. I don't have to ask every single question that comes to mind, every single little detail. And as aesthetic professionals, we reserve the right to tell our patients everything that we feel they need to know. And at some point, you're going to have to say, hey, you need to trust me as your aesthetic professional. Do you, the patient, believe that I have your best interest in mind, that I'm going to do what's reliable, what's safe, what's appropriate for your aesthetic concern? And if the patient can say yes, then that relationship, you can build on that. But After you feel like you've done your due diligence as an aesthetic professional to tell your patient, hey, I'm going to do X, Y, Z. These are the results you can expect. This is the safety profile. These are the possible adverse events that could happen. However, I'm going to do my best for you, and we're going to achieve the best result possible for your situation. If the patient is unsatisfied with your result, then after a certain point, I think it's pointless to try to continue down that rabbit hole to the point of the patient satisfaction, because I don't know if there will be a point of satisfaction for that particular person. So going back to that patient who wanted Botox to be reconstituted, redrawn up, and administered, with her seeing the entire process, we said, you're not welcome here anymore. In terms of what that means for me in this office, for the professionals who work here, I think the patients need to trust that we have your best interest in mind. We have your safety in mind. We're driven by getting results for you within that sphere of safety to achieve the results that you want to help achieve a more beautiful version of yourself. And that's, I think, the general principle when it comes to having somebody guide you on your journey, that there needs to be that trust between the patient and the guide. And so I believe that as the guide team, we have your best interest in mind. We're not going to get the super cheap counterfeit black market Botox to administer to you. We're just never going to do that. And you need to trust that we're not going to do that. I'm very curious to hear your feedback. As an aesthetic consumer, what do you feel is the appropriate situation? And aesthetic professionals, I want to hear from you. What's your take on this situation? If somebody told you, I want to see all of your cooking from beginning to end before you serve it to me, would you acquiesce to that? Would you comply with that? Or would you say that this relationship is not worth continuing and you should see someone else? I think this is a crucial part in terms of the patient-provider relationship, in terms of helping to make the world a more beautiful place, helping our patients achieve a more beautiful version of themselves. I want to thank you for tuning in to this episode of the You Are Beautiful podcast with J. Kim, MD. If you haven't yet, leave a comment below. We'd love to hear your feedback, especially about this hot topic. And until next time, remember these 3 core truths. You are beautiful, you are unique, and you are worth it. Have a great one.